Hey everyone, welcome back to The Dish. I'm Anna Christina and I'm joined by Dr. Miller. She's with Augusta Oncology as well as the Georgia Cancer Center. And if you're just tuning in, we're highlighting and bringing awareness to ovarian cancer. September is Ovarian Cancer Awareness Month. And Dr. Miller, first of all, thank you so much for joining us.
Thank you for having me.
And what an important conversation. We just finished talking about ovarian cancer being known as the silent killer. Tell us why that is, and let's go over some of those symptoms and what they look like.
Absolutely. So, like we talked about a little bit earlier, oftentimes the symptoms of ovarian cancer are very vague. They're things like bloating, changes in bowel habits like constipation, feeling full after you just eat a little bit of food, or sometimes some vague abdominal pain. And so oftentimes patients are able to explain that away with other things. And even if they see a doctor who's not a GYN oncologist or a gynecologist, they're often, not aware of what could be going on.
Right. And it's similar, was able to talk to you a little bit before we got started about my mom and her story. And she actually had to get a second opinion. At first it was, well, I think it's just gas. I mean, you're bloating. And so when she finally went to this for the second opinion, they did find a tumor the size of a grapefruit. And by then it was kind of like, well, we're kind of, a little bit late in the game here. And so fortunately she did go for that second opinion, and she was aware and she was in tune with her body. So she was able to go and start her treatments. And so that's the other thing I want to talk about. Obviously, you guys see your patients from start to finish. You're the only ones that really are able to do that, which is so important because you get to stick with the individual and their needs and know what they need. Tell us about some of those treatment options.
Yeah, that's a great question. What I tell my patients when I meet them with ovarian cancer for the first time is that your treatment will likely involve a combination, at least initially, of chemotherapy and surgery. And our goal is that we do the most aggressive thing but also to limit the side effects that we're going to give you. So if we start with surgery, we do a big surgery, usually through a bigger incision, and then we treat with chemotherapy afterwards. And if sometimes, in some circumstances, we have to start with chemotherapy first to shrink things down a little bit so we can have a really successful surgery. And part of our specialty is being very aggressive surgically, but also aggressive with medical therapies and chemotherapies as well. And so most patients, almost 90% of our patients will get into remission with that combination in the upfront setting, as we call it, so the beginning of their journey.
Right. And it's so important what you guys do. And I'm, hopefully not many women will have to come and visit you, but if they do, they're doing so because they're trying to get out in front. And but the options are there for treatments. You guys do a wonderful job there with Augusta Oncology and Georgia Cancer Center. And there's also genetic testing. I want to make sure that people are aware of that as well.
Yes. When any patient comes to us with ovarian cancer, they're actually recommended to get genetic testing for hereditary breast and ovarian cancer syndromes. Additionally, if the patients have risk factors in their family, a family history of ovarian cancer, or several family members with breast cancer, it's recommended as well. This is even more important nowadays because a lot of our targeted therapy for cancer has to do with genetics within your body itself and within the tumor. And we've actually been able to increase the lifespan on a lot of our patients based on that type of testing. So We really strongly recommend that.
Well, Dr. Miller, thank you guys so much for what you're doing there. And if you need more resources, you can go to the information on the screen. Again, thank you so much for being here with us.
Thank you.
All right, guys, don't go anywhere. When we come back, we'll have more on The Dish.